pregnancy was very normal. I had a sort of odd labour with her that didn't progress in a way that I didn't understand at the time. I don't think I or anyone thought that there might be anything seriously wrong. It just seemed to be one of the ways in which, babies can present and labours can get difficult. By about age of 2 weeks, I would say I was probably spending about 20 hours a day trying to feed her. I just could not get her to feed. I was trying to get the attention of the midwives or the doctors, and I was just completely dismissed and fobbed off. I was absolutely convinced something was terribly wrong. Friends and family would come over and they'd say, "Oh, look at her looking at the trees, isn't that lovely?" Or "Look at her looking up at the window." And I would look at her and I would think, yeah, but is she? I don't think she's got any sight, she's not fixing, she's not following, she's not smiling, she's not holding her head, her muscle tone is really, really low. There just seemed to me to be 1,001 things about this child that are not as they should be. I was being told by everybody that it was normal and I was anxious. I finally got in front of this brilliant doctor and shared all these concerns. It's a moment I remember. I was so relieved that someone was finally taking me seriously. And she examined Em and she said, "I agree with you. And I think that we should send her for an MRI urgently." And that's sort of where it all started and where it all changed.
Vici Syndrome is a horrific multi-system disorder that affects children. Currently, there are no available treatments. Management of patients with Vici Syndrome is purely symptomatic.
The line I remember was it said something like, "Vici Syndrome is one of the most serious multi-system genetic disorders known to modern medicine." And then it listed, the 1,001 implications for a child's life.
It affects almost every system in the body, causing major defects in the central nervous system, in the heart. It affects the immune system, in particular in terms of development, and almost as a double whammy. On top of the development, there's a neurodegenerative component. So these children really suffer from multiple disorders.
I think the only question I asked was, what's the life expectancy? And she said 42 months. It has changed every detail of our life. I think in some ways COVID is quite useful as a reference point because we say to people it's basically lockdown, that's how we live. A typical day for us often starts very early. So Em sometimes will wake at midnight or 1 and that will be the beginning of her day. She then has her first set of medicines at 6:30 in the morning, and then every sort of half hour to a couple of hours throughout the day. She then will have activities that we do throughout, so certain kind of physiotherapy or spending time in different equipment, especially having her standing up is really important for her. We take each day as it comes. Tilly is Emily's big sister. She is 5. I find so much joy in the tiny things that Em and her sister enjoy together. They're so inventive in how they play together. And I think the reaction from Em is so obvious. We use a special type of sign language with Emily called Canaan Barry on-body sign because she can't see. So we need a sign system that she can feel on her body. We each have a sign to identify ourselves. So I squeeze her shoulder to say that it's mummy. Tilly shakes her foot to say that it's Tilly.
It's Tilly, Mummy.
It's actually really comforting, I think, as her parent, to know that she has that ability to tell us what she needs, because it ultimately is how we know that she's happy.
The basic research that we're doing is essentially fundamental cell biology. We're trying to understand the consequences of mutations of this EPG5 protein for cell biology. Mitochondria are incredibly important. They provide all the energy in the cell. To what extent does the mitochondrial dysfunction contribute to the development of the disease progression? So we think that mitochondrial dysfunction is likely to contribute to the longer-term problems that these children have. In particular, we want to ask whether we can recover mitochondrial function pharmacologically could be really important. And there are a number of compounds, drugs, which have already been approved for clinical use in people, and whether there's a prospect to redeploy those drugs to use them in patients with Vici syndrome. If we can rescue function in this model, then that raises questions about whether we could equally rescue function in other neurodegenerative disorders and right up to more common diseases such as Parkinson's disease.
I think the research that Action is funding into Vici Syndrome is really exciting, apart from anything just because it is such a rare disease that any level of kind of clinical interest and input can only help children like Em.
The funding that we have from Action Medical Research is incredibly important. It allows us, of course, to address the basic biological questions and hopefully to come up with solutions. I think that for patients with Vici syndrome and with other rare neurological diseases in childhood, there is light at the end of the tunnel.
It's about an investment in the children in the future, families like ours who, you know, in whatever 30, 40, 50 years' time when receiving this diagnosis, have something that they can do to help that child. That will be an incredible legacy.
You're laughing again!